Peanut patch shows promising results in clinical trials for toddlers with peanut allergies. That's according to a new French study, and there could be a needle-free way to treat allergies in the future. Dr. Reena Mehta with Uptown Allergy and Asthma joins us to explain both of those developments. Good morning to you, Dr. Mehta. This study involved a patch that basically included a tiny amount of the peanut protein?
Exactly. So this was a study recently published in the New England Journal of Medicine where they looked at toddlers, so those ages 1 to 3 years of age with peanut allergy, because for these patients, we currently don't have any recommended guidelines as a way to desensitize them. So up until now, it's been avoidance of peanut. Well, this study looked at a peanut patch, basically a patch that the baby or toddler could wear on their back. And what they did was they studied over 300 toddlers for over a year wearing this patch. And what they found was that the patch actually contained about 1/1000th of a peanut, but they were wearing the patch every single day. And at the end of the year, those that were less sensitive to peanut were actually able to ingest or orally eat about 3 to 4 peanuts. And those with more severe peanut allergy were able to eat about 1 peanut without having an allergic reaction.
It's the point being that if a child came in contact with a small amount of peanuts, it wouldn't be some potentially life-threatening event.
Absolutely. So what this is doing is protecting against cross-contamination, raising that threshold so that if the child was accidentally exposed to peanut, they wouldn't have a huge anaphylactic reaction.
How limited, when you do a study, you always want to look at, what were the limits of the study. From what I have read, this did not involve children with a history of severe reactions. Does that limit how effective this might be or what we know about it?
Of course, absolutely. So, with every study, there are limitations. And what they did do is they excluded those with severe peanut allergy and included those with more mild to moderate peanut allergy. So, of course, you are potentially missing those more severe peanut allergy. But, the thing about the infant age and the toddler age is their immune system is very plastic, meaning that it can change and it's very malleable at that age. So the hope is that if we can catch these toddlers early with their peanut allergy, we can hopefully intervene before it becomes a more severe issue.
The other development is the EpiPen and the fact that there may be a nasal spray substitute coming.
Yeah, so this is really cool. A lot of people get really scared about using an EpiPen because it's a shot, it's an injection, especially in a child. And so this is a new product. It's a nasal epinephrine. So it's a nasal spray called Neffy that will be up for FDA review in the middle of this year to look at whether it could be used as an alternative instead of the EpiPen.
And this was already voted on by an FDA panel that voted in favor of it. Basically, they're finding the results are similar to what you would get from an EpiPen, or how effective is it?
Exactly. So while it might be surprising, because when you think of a shot having a more systemic effect, they found that the nasal spray was actually very efficacious in reversing anaphylaxis. They found comparable results when you use the nasal spray to when you use the EpiPen in reversing an allergic reaction. Now, with the
I'm sorry, go ahead.
Yeah, you may have to use it more than once. You may have to, wait a few minutes, wait 5 to 10 minutes, and if the, reaction is still progressing, then you might have to use it again. But that being said, it was very effective in reversing anaphylaxis, and maybe for those needle phobic people, this may be a good option.
Gotcha. And we've got about 20 seconds left, but a silly question maybe is nasal congestion an issue? Do they know enough about how this would work?
So that is not a silly question. That's a great question, because obviously when you're having an allergic reaction and you get congested, the question is will this nasal spray be as effective? And that is still out for debate. We're still trying to tease through, the more details, but it may be that if you're congested, you might have to use the nasal spray a couple more times to get effect rather than just using it the one time.
Gotcha. All right, Dr. Reena Mehta, we appreciate it as always. Thanks so much.